World Cancer Day is coming up next month, 4th of February. And this morning, before we get to the top of the hour, we want to have a discussion on our Your Health segment. And I'm talking to Dr. David Makumi, who's the Vice Chair, Kenya Cancer Association, as well as Dr. Isaac Odongo, Head of Oncology Unit, Ministry of Health. Gentlemen, good morning.
Good morning.
Thank you for making time for us this morning. So World Cancer Day, tell us about this particular day and how it came about.
World Cancer Day has been celebrated for a number of years under the auspices of the International Union for Cancer Control, UICC, which is based in Geneva, and the WHO. It is a day that was set aside to refocus governments, the public, ordinary citizens, and healthcare professionals as well to the plight of cancer patients, and also to redouble efforts around cancer control. It's celebrated globally on 4th of February. Yeah.
Okay, Ministry of Health, how are you coming in? What's the role you're playing in as far as this is concerned on that particular day? What has been prepared or set up?
Yes, the Ministry of Health is playing the role of coordinating and spearheading the function of celebrating this. We intend to have a breakfast meeting today, and then also we are going to have screening at various sites at the Ministry of Health headquarters, and we also intend to have the main celebration on the 4th in Eldoret, and various dignitaries will be invited in this during this occasion, which will involve screening of patients at the public. We also involve a walk, and there will also be a talk by the various dignitaries from the ministry and the political aspect of the nation.
All right, so there will be a walk that we'll be seeing on that particular day.
There will be a walk.
But let's talk more about the numbers and where Kenya stands in terms of statistics and the fight against cancer, one of the major killers we know in the world. So what are those numbers and statistics when you're looking at Kenya and how we stand?
The numbers are not looking good, and they are, I would say, ever increasing. The latest statistics that we have are estimates from GlobalCan. GlobalCan is a global watchdog that keeps a tab on cancer numbers around the world, and the numbers they have given us for Kenya, in combination with what we received from the Nairobi Cancer Registry based at Kemri, give us almost 33,000 new cases, with approximately 24,000 deaths annually. Those are really estimated numbers, because there are many other patients who would probably die in the rural areas without a diagnosis. So we suspect that the numbers actually could be much higher. And given that, again, our infrastructure in terms of capturing every single case from every county is still under development. A lot of work is happening around cancer registry. We are not there yet, but there is a lot of work in terms of establishing registries, which would help us capture, numbers very, very accurately. So the numbers I've just mentioned would give us a roughly like 70 deaths a day. If you had to work them out, in a manner that we would understand that those are numbers that are worrying very well.
And what would you say is causing that increase in numbers? Why are they shooting up?
The cases that we are seeing, not just in Kenya, but I would say in sub-Saharan Africa, they're a combination of factors. We cannot pinpoint to one specific thing and say this is it. Otherwise, we would have fixed it a long time ago. But they're a combination of factors. Lifestyle. Changing lifestyle as our countries develop and become industrialized. We are also probably earning more, meaning that we are eating a lot more junk in terms of the diets, heavily fried foods, lack of exercise, and the biggest one, really the big one, is tobacco. That is unequivocal that tobacco use is increasing among young people in Africa, in our country as well, among male and female, and tobacco is responsible responsible for more than 12 cancers. So the other factors, they're also infectious agents, like viruses. We know cervical cancer is associated with the human papilloma virus, and cervical cancer is one of the leading killers of women in our country. And there are also infections like hepatitis B. Again, those are big time responsible. Sedentary lifestyle, I've just mentioned that we exercise, we eat more, exercise, and also exercise less. Yes. So having said that, there are also other factors that we have not understood. We still need to get to do a lot of research, because the factors I've mentioned are responsible for only 1/3 of the cancers, so which are actually preventable. So there could be other genetic and other environmental factors. Industrialization, our workers are working in industries with fumes and chemicals that are carcinogenic without good protection. So these are also factors that have been responsible. Yeah.
All right, Dr. Odongo, in as far as the Ministry of Education, Ministry of Health, I beg your pardon, is concerned, and the involvement in this fight, what is it you're doing to ensure that this information about cancer and, some of these things that could be done to prevent is infiltrating to the grassroots level? Because you have a lot of people in the urban areas perhaps getting access to the information, but as a ministry, how are you ensuring that the populace is informed?
The way we have been doing this is, one is like the World Cancer Day, and the other ways which we've been doing is using our health workers.
So when you say World Cancer Day, what do you mean? Do you have meetings all over the country in the different counties, or is it just one-off event in Nairobi and that's it?
No, I think apart from not only one-off event, we do encourage all hospitals, own areas, to have their own episodes of celebrating the World Cancer Day. Two, we ensure that we will have a supplement in the newspaper that will talk about World Cancer Day and the causes of cancer and what as a ministry we're doing. We have also, using our partners, various partners, come at the initiatives to help us in pushing forward the agenda of cancer and what we have in cancer and what we are doing. In addition to that, we also have health workers. We also have community health workers, various workers who interact with the community. And when they do that, they also pass the message on cancer.
Okay, and which one would you say is the most prevalent type of cancer? Because you have many different types.
Well, amongst women, the most common cancers are cervical cancer, breast and esophagus. While amongst men, we have prostate cancer, followed by esophagus and colon and gastric cancers, cancers of the stomach. These are the most common types of cancers.
Right.
And also Kaposi sarcoma, which is associated with HIV.
All right. And we usually see October Breast Cancer Month, and now there's World Cancer Day. There's a lot of attention in as far as cancer is concerned. Why is that we see a lot of this kind of attention, having a whole month focusing on that and education and putting it out there, having a World Cancer Day? Why, in your opinion, is that?
Well, it's important maybe at this point to point out that most cancers have a month of observance. And the best known is October, the pink month. So most people think October is actually cancer month. But strictly speaking, October is dedicated
to breast cancer.
And worldwide, the breast cancer movement, we have had women come out and talk about breast cancer and the fact that they have had breast cancer. And actually, in most countries, it's the women who have had breast cancer who've pushed the cancer agenda and pushed the cancer advocacy, because women talk a lot more than men do when they have a problem. So it just came to pass that October became more well known and associated with cancer. But other cancers, like colon cancer, Dr. Odongo has just mentioned that gastric cancers or cancers of the food system, the colon and the stomach, they're also very, very prevalent in our country. Actually, they are like among the top 5. And those are observed in March. Actually, March is supposed to be the blue month, when October is the pink month, because the color for colon cancer is blue, and that is observed in March. Prostate cancer is observed in September, cervical cancer in January, childhood cancers, I think, is in June or in July. So all cancers have their month of observance. What hasn't happened is that we have not paid attention to all the cancers as we should be. So World Cancer Day is actually a good time for us to reflect as a country, as cancer workers, as people who work with cancer patients, as cancer activists, as government, to reflect on where we are about not just on breast cancer, but focusing on all cancers. What strategies do we have to mitigate the effect of cancer? What resources do we need? What can we do as civil society, working with government and healthcare professionals and providers, really to address the cancer problem? So, strictly speaking, if we are to educate every Kenyan, every month has a cancer.
Wow.
You need to look out for that.
Talk cancer all year round.
All year round. And that's how it should be. We need to talk cancer, not during specific days, but every day. Cancer does not sleep, does not wait for special months. All right. Dr. Odongo, in terms of the government's role in having infrastructure to control, to treat this particular various types of cancers, and also research, investment in that as well, what has been put aside for that?
Well, in terms of cancer treatment, first of all, I must say that there are three main modalities of treatment. We talk of what you call radiotherapy, chemotherapy, and radiotherapy, chemotherapy, and surgery. Now, in terms of treatment in the public sector, we have what we call, when we have those three, we have what we call comprehensive treatment of cancer. There are two centers, which is the apex of our referral system, that is Kenyatta National Hospital and Moi Teaching and Referral Hospital. And then also within our what used to call provincial hospitals, now we are calling as referral hospitals, which are about 11, like talk of Nyanza, Nyeri, Coast General. We have the modalities of treatment where we have surgery and some chemotherapy going on.
Right.
And when you go down further to the lower hospitals, where we talk of district, or what we call level 4 hospitals.
Yes.
An example is like Kiambu District Hospital. We again have mainly surgery and a little bit of chemotherapy.
But how do you also make this, and what is the plan to make it more affordable and accessible to ordinary Mwananchi? Because this, we know, very expensive. It's there in a few hospitals. But for ordinary Mwananchi who call mashinani, what is the plan to ensure that they too have a chance to live with cancer if it's not curable for those that are not?
What we have done is, as a government, we hope that, the thing is, cancer medication and commodities are very expensive.
Correct.
And for a long time, the government had not been procuring this. We, after coming up with what's called the National Cancer Guidelines, we are going to focus, and we hope that we are not going to be able to buy these drugs.
Okay.
And when you buy them in large volumes, then you bring down the costs.
Correct.
And through KEMSA, if the government will do that, then we will be able to avail them in our referral and various hospitals.
All right.
And this will probably make it more affordable
to everybody.
Yeah, to everybody.
Okay, finally, we must bring this to a close. Our time is up. Daktari, in terms of what you've seen out there, information put out on cancer, what are some of the misconceptions and myths you'd say that need to be addressed and you'd address very shortly?
Thank you very much for that question, because we should have started by saying the theme of this year's World Cancer Day. And every World Cancer Day has a theme which we actually reflect on for the rest of the year. The theme this year is debunking cancer myths. We need to debunk. There are lots of cancer myths flying around. Every country has its own unique myths. There are people who believe that cancer is infectious. Cancer, you can get cancer from someone who has had cancer. But in our country, there are certainly very, very unique myths that we need to address. For example, these days we are seeing lots of patients coming to us and saying, "Oh, I'm eating quail eggs and quail meat. And so do I need to continue with chemotherapy? So those are the myths that we are observing. I know every time people talk about using nutritional supplements instead of using conventional treatments that Daktari has mentioned. And so people say, oh, I'm on a nutritional kind of therapy. Yes. I'm eating quail eggs. I'm eating this, that, and the other. So those are some of the myths. So the other myths is that there are people who believe children don't get cancer. And it's also important to remember that 15th of February, we actually have a special day for childhood cancers. And the children do get cancer. So it's important. It's another myth that people think cancer is for the elderly, cancer is for the rich. Cancer affects just everyone, rich and poor alike. And there are also myths around witchcraft in our country. I mean, especially in the rural areas, but also in the urban areas. Witchcraft and the belief that, you know, maybe somebody did something to us, you know, akanirushia, those things. So
you're hoping to be able to
debunk some of these myths, but also that 1/3 of cancers are actually curable. You know, there are realistic chances of cure. Get the cancer early, and we will be able to cure at least 1/3 of the cancers. Another 1/3 are preventable. And there is something we can do about the other 1/3, which is palliative care for those with advanced diseases. So there's something that we can do about cancer in this country. And another myth is that not every patient should go overseas for cancer treatment.
Yes. And that is why we had engaged Daktari in what exactly we have in terms of facilities to treat the same in the country. Thank you both for being with us this morning. Dr. David Makumi, Vice Chair, Kenya Cancer Association, and Dr. Isaac Odongo, Head of Oncology, Ministry of Health. Asanteni sana. We wish you all the best on World Cancer Day with the campaign 4th of February that will be happening in the country. We've heard about a run and other events around the country that will be taking place to commemorate that particular day. We're glad you're watching Morning Express.